Sexual health is a vital yet often overlooked aspect of overall well-being, clouded by societal taboos and misinformation. Many people assume that sexual desire is static, but in reality, it fluctuates due to factors like stress, hormonal changes, and emotional well-being. Mental health, particularly conditions like anxiety and depression, can significantly impact libido. Yet these connections are rarely addressed in routine medical consultations. Sexual dysfunction, such as erectile dysfunction or low arousal, is also more common than acknowledged, affecting individuals of all genders and ages. But shame often prevents open discussions. Hormonal imbalances, like those caused by thyroid disorders or menopause, can alter sexual health dramatically, yet patients seldom receive clear explanations about these links. Psychological factors, including past trauma or relationship conflicts, further complicate the picture. Open communication with healthcare providers is essential, but many patients hesitate due to embarrassment or fear of judgment. Breaking these barriers requires education and normalization of these conversations. By understanding the biological and emotional dimensions of sexual health, individuals can seek appropriate care and improve their quality of life. Empowerment comes from knowledge. Knowing that variability is normal and help is available. Many people assume that sexually transmitted infections, STIs, always come with obvious symptoms, but this is far from the truth. In reality, infections like chlamydia, gonorrhea, and HPV often show no signs at all, allowing them to spread unnoticed. Asymptomatic carriers may unknowingly transmit these infections to partners, which is why regular testing is essential, even if you feel perfectly fine. Waiting for symptoms to appear before getting tested can lead to long-term health complications, such as infertility or increased cancer risk. Open conversations about sexual health with partners and healthcare providers help break down the stigma and encourage proactive care. Testing is the cornerstone of STI prevention, yet many avoid it due to fear or embarrassment. However, modern testing methods are quick, confidential, and sometimes even available at home. Early detection allows for timely treatment, reducing the risk of severe outcomes. Beyond testing, safe sex practices, like consistent condom use, dramatically lower transmission rates. Vaccinations, such as the HPV vaccine, offer additional protection against certain viruses linked to cancer. Educating yourself and others about these tools is key to staying healthy and stopping the spread of infections. Misinformation about STIs fuels unnecessary fear and shame. Some believe only certain groups are at risk, but the truth is that anyone sexually active can contract an STI. Others think oral or anal sex is safer, but infections can still spread through these acts. Clearing up these myths with facts empowers people to make informed decisions. By normalizing conversations about sexual health, we can replace judgment with understanding and prioritize well-being over outdated stereotypes. Knowledge is power, and in this case, it's also protection. Contraception is often presented as a one-size-fits-all solution, but the truth is far more nuanced. Hormonal methods like birth control pills, patches, or injections can regulate periods and reduce acne, but they also come with potential side effects such as mood swings, weight gain, and even increased risk of blood clots in some individuals. Non-hormonal options, like copper IUDs or barrier methods, avoid these hormonal impacts but may cause heavier periods or require more rigorous user adherence. Many people aren't aware that no contraceptive is 100% effective. Even methods like the pill can fail due to human error or biological factors, and failure rates are rarely discussed openly. The stigma around contraception can lead to misinformation or reluctance to seek professional guidance. Some assume that because a method is popular, it's universally suitable, but individual health histories, lifestyles, and preferences play a huge role in effectiveness and comfort. For example, a person with migraines or a history of thrombosis might need to avoid estrogen-based options. Open conversations with gynecologists or urologists are essential to find the right fit. Yet, many hesitate to ask questions due to embarrassment or fear of judgment. Accessibility is another overlooked reality. Cost, cultural barriers, or lack of healthcare access can limit options, leaving individuals with fewer choices than they deserve. Education on contraception should go beyond basic mechanics. It must address these complexities to empower people to make informed, personalized decisions about their sexual and reproductive health. Breaking the silence around contraceptive realities is the first step toward safer, more effective family planning.